Hey guys, Don here. I want to talk about today diagnostic ultrasounds. Now, this podcast it's not about the technical component of how to do a diagnostic ultrasound or why to do a diagnostic ultrasound, but it's more on the ways you can be more profitable and efficient with doing them. One thing I always found when I was doing ultrasounds, I still find, is that kind of like with X-rays, when you show them the X-ray, the only thing they look at are those two little round dots and they say, "What are those? Are those normal? Those are your sesamoids, Mrs. Jones." And what I find when I show people the ultrasound, no one knows what they're looking at. And so what I've found that works really well is I've made a couple of basically Google slides on a few of the diagnoses that I use. For example, plantar fasciitis or Achilles tendonitis or like metatarsalgia or plantar plate tear. And each one has a little slide. And then I show some like a normal anatomy pictures. And then I'll show some actual ultrasound examples and I'll kind of orientate them to where the anatomy is. For plantar fasciitis, I'll show them that the foot is upside down. I'll show them the thickness of the fascia, what a normal fascia is, what a really thick fascia is. And I'll do this when I'm not only in my presentation as I'm talking about plantar fasciitis, which we've talked about in the past about these patient presentations, but I'll also, when I'm doing the ultrasound, let's say the second visit they come in, or even the first visit, if they come back and I say, okay, today we're going to do an ultrasound, let me show you this picture before so you can kind of see what normal would be like, what the normal measurements are on the plantar fascia, and then kind of we'll evaluate it to yours. Now, I also do their right and their left foot so they can see the difference there, but I find that showing that picture there really makes it easier. Another quick tip as well, when you're doing ultrasound, patients, just kind of like when they're having a baby, they love to take pictures of the ultrasound. And so this is a way not to violate HIPAA. You just say, hey, why don't you grab your cell phone, take a picture of this ultrasound view, point out things to them. You can even mark it on the actual ultrasound where their plantar fascia is, how thick it is. And you can do the same thing with x-rays. So there's a couple of tips with working with diagnostic ultrasound. If you guys want a copy of the actual presentation that I do, just send me an email. And then you can get. I'll send you the PowerPoint slide of the slides that I'm currently using. Okay. Also, I want to invite you guys to the group session. Basically, go to podiatrypracticemastery.com and just sign up for the group session. We'll let you know when they're coming out. If you can't be part of it, we'll just send you the replay so you can listen to it. This next one we're going to be talking about is on using webinars for your patient practice. Okay. Have a great day, guys.